And I'm going to start recording here. Okay, this morning we'd like to introduce my favorite patient, and that's facetious because you're all my favorite patient. And we say that kind of facetiously because there's a little bit of kind of gentle back and forth amongst doctors who do different kinds of bariatric surgery. You know, oh, Dr. Rutledge does the mini-gastric bypass, oh, and then we say, oh, they do lap bands, oh. And in a nice, gentle, polite way, we have this back and forth about it. And so when we get one from their side, we like that. So you mind summarizing your story again? You had a lap band 4 years ago?
3 years ago, October 2005, I had lap band placed. I lost 30 pounds. And
good.
Yeah, and then one was pregnant and lost another 40 pounds.
So a healthy baby.
Mm-hmm.
And,
perfect pregnancy.
With additional weight loss.
Mm-hmm.
So if we had gone back and videotaped you at that point,
I would have said, oh, as a matter of fact, I even said postpartum, oh yeah, lap band, I'd do it again in a heartbeat.
yeah. So lap band seems good, and we have lots of friends and family who've had good experiences with the lap band. It's not a bad thing. On the other hand, after a while, something happened.
Yeah. Right after my pregnancy, I went to go get a fill put back in so that I could continue my weight loss. And
can I interrupt to explain?
Mm-hmm.
So the lap band has a little reservoir, and you can inflate it like a balloon. And the idea is that if you change that balloon, you can change the squeeze. And the idea is if you get it just right, then you'll have just the weight loss that you want. You'll be able to eat just enough, not too much, and it won't be too tight, but it also won't be too loose. And if you get to that kind of sweet spot,
right,
then the band works well.
Right.
So you went back after baby.
Right. My baby was 3 weeks old. I went back for a fill. It was just a tiny bit too much, and I got just a tiny bit of fruit from yogurt stuck in it. And I couldn't eat or drink for about 36 hours. And while I was waiting to get that fill taken out, because it was in another state, it was in Washington, and I'm from Oregon. During that time, I was thirsty. I was breastfeeding my baby. I was incredibly thirsty, and I was drinking, vomiting during the night, just waiting to get the rest of this fill taken out. That, I think, probably caused my band to slip. So it had been sutured in place so to prevent the complication of slippage.
Right, it's not supposed to slip, right?
Yeah, and during that time, I think those sutures probably tore, even though I didn't feel it at all. And so probably about 6 months after that is when I started really experiencing problems that made me need to get the band taken out.
And the problems are kind of spit up and reflux and not able to eat well. And
it got, in the last probably 2 weeks, it got so bad that I was frantically emailing and calling Dr. Rutledge going, okay, I don't know
so
how much
normally
longer.
we have people as a group because we like to have everyone be kind of self-support. Each one of you gets to talk with one another, talk about your experience. But Ann was kind of the Lone Ranger from last week. She came all by herself because she called, said it was an emergency, and I was having what we call a staycation.
A working vacation.
Staycation, where that's a vacation where you don't leave home.
Mm-hmm.
So, no, actually, we went to California for a couple of days. So, as soon as we got back, we made arrangements for an emergency. We saw you on Tuesday and made arrangements to do surgery that day. And just to let everyone know, and as you and I talked about, just as you expected, we saw the band had slipped down. There was a big bubble of stomach above it that was swollen, thinned out, and could have perforated, and sometimes they do, and that's, of course, even worse. But we were able to get that out, get the band out. It slipped out easily, which is nice. That's one of the good things about the band. It's very easy to revise. So we sometimes get in the habit of just running down the band. Oh, the band is bad. Oh, it's bad. And we need to point out that, first of all, it did give you the weight loss, maybe helped with the delivery of a wonderful baby girl, right? So there are some good things about it. And also, one of the great things about the lap band, easy to get out. So we were able to easily get it out. And then we did a mini-gastric bypass on top of that. And because the tissue was a little beat up, the day or two afterwards, you had trouble swallowing, and we talked.
Well, and I had been on IV fluids only for 10 days at that point. So I was really just trying to get fluids just to bypass having to eat or drink anything into the stomach because it was so bruised and beat up. And so anyway, yeah, I did have a couple of days there after surgery I had a lot of nausea, and really I think it was just that bruising in my tummy. Feeling anything go through it made me feel, because I'd become so accustomed to vomiting also. My gag was really sensitive, yeah. So, but once things really started to wake up, kind of my body started waking up.
Some of the swelling goes down.
Swelling went down, my bowels kind of woke up, then boom, turned the corner, and Friday was running around, you know, having a good time, and Saturday and Sunday, and so.
So you're bouncing back.
Oh yeah, feeling great.
Good. All right. Questions that you and I should talk about? Anything that we should worry over, discuss with you, or things?
I'm just really extremely careful about anything I'm putting in my mouth, even though I've been, you know, watching friends. I had my husband here for the first week or so, and then a girlfriend, he flew out and a girlfriend flew in for the weekend, and so I've been watching them eat all week. And, you know, I've just been very militant about what I'm putting in my mouth, and just taking it easy because I'm very, very cautious about my new tummy and taking care of it properly because I don't want to end up getting sick.
Complications.
Yeah.
Sure. Anything that's not clear on our instructions or anything like that?
I don't think so. Anytime I've had a question, I just refer to the packet before I call, and it's there.
Pardon me?
I just refer to the packet, and it's there. It really is. Every time I've had a question, I just look through the packet, and it really is right there. So
we have everybody, you know, they all call. Everybody calls us all the time. And we'll go, oh, no, that's in the packet, but let me tell you, that's in the packet, but that's in the packet. And, but so what you're saying is read the packet before you call. Is that what you're saying?
Just look, it's there.
So wild. I've never heard that before. Just crazy. That's crazy. That's crazy talk. Well, that's great. Anything else that we can answer for you? Any questions or?
I don't think so.
Okay.
Any
comments? Do you judge the nurses or the hospital? I mean, can we say it's okay to say you're a nurse?
Yeah, I'm actually an operating room nurse too.
Right,
so yeah, everything was real familiar to me.
Good.
But yeah, everything was just wonderful. I mean, it was the staff in pre-op, the gal that brought me back to the OR, the nurse there, everybody there, my nurse that night, everybody has been just wonderful.
They treated you well. Good. Okay.
Yeah, it was just
well,
wonderful.
and you know, you can call me. Of course, we've had phone calls before, so as you get ready to go back home, you know, stay in touch. There is still chances that things can come up, but most of our risk is in the first 7 days, so you should be on your way to a healthier and better life. So, thank you so much.
Thank you.
All right. Any questions anybody want to ask about?